Good morning, guys. Today I am going to review my GT mistake notes. Okay, so first this concept Merkel, Meissner, Passinian, Ruffini, Krauss, and Freena endings. So Merkel, Meissner. Okay, so Merkel 2 point discrimination. Meissner and Passinian both are rapidly adapting. Ruffini and Krauss endings are slow adapting. Ruffini and cross endings are slow adapting. And free nerve is for pain and cross is for temperature. Okay. Next, for in obstetrics, for 6 weeks in abortion. Okay, for 6 weeks we use syringe. For 12 to 13 weeks we use manual vacuum aspiration syringe. And for the same we can use also suction and evacuation. So mainly for 6 weeks syringe, more than 12 to 13 weeks we can use manual that means aspiration syringe and also suction and evacuation. Next, that is most important, that is partial mole and complete mole. Always remember, partial means is half only, right? Partial, but it carries a higher number, 69 xxx or xxy. In partial mole there will be one sperm, but it will be duplicated and a ovum. Okay, always remember, like in partial and complete the change will be in ovum. In complete mole, in ovum there is no empty ovum. Okay, there is no XX. But in partial mole, the ovum contains 23 eggs. So in partial mole, at least there should be one X. Remember this. Okay. And also, okay. So partial mole has 69 XXY and complete mole has 46 XX or 46 XY. Next, chromosome of anti-Mullerian hormone. It is chromosome 19. Chromosome of anti-Mullerian hormone is chromosome 19. Next, we have septic abortion, right? In septic abortion, which bacteria? That is group A, Streptococcus. That is Streptococcus pyogenes. We have two groups, right? Group A, Group B. Group A is Streptococcus pyogenes and Group B is Streptococcus agalactiae. So in septic abortions, we have Group A. But in preterm labor and also for meningitis, see, the child who was born preterm only have meningitis, right? Neonatal meningitis. So it should be group B. Okay. Streptococcus agalactiae. Then it's more important. See the testing of chromosomal abnormalities, 10 to 13 weeks, 15 to 20 weeks, 18 to 20 weeks. Okay. First step, 10 to 13 weeks. Small step, right? Chorionic villi sampling. 15 to 20 weeks, amniocentesis. 18 to 20 weeks, chordosynthesis. First, it is easy to test villi, then amnion, then the next only cord. Okay, villi, then amnion, then cord. Next, we have peripheral artery, triphasic waves. Peripheral artery has triphasic waves and visceral artery has which waves? Biphasic, monophasic but without pulsation. And veins, wait, okay, just remember, peripheral artery has triphasic and visceral artery which is monophasic without pulsation. Visceral artery monophasic without pulsation. Next, the techniques of tubectomy. We have totally 4. Madlener, Irving, Uchida, Cronus. Madlener. See, which is mad. They are mad. Okay. So, they will tie the both sides and crush that. Like they will both like in the isthmic junctions they will tie and they will crush it. Madliner, Irving. So they will cut the tube. One side will be brought back to the uterus and other side will be kept open, like tied and they will kept open. Okay, Irving. Like Irving means like you keep it like hugging. So one part of the tube which is attached to uterus comes back to uterus. Okay. Then Uchida. Uchida. You keep you remember like it's like a head, top of the head. Okay. So one part of the tube will be kept open and facing the top. Another part will be ligated and it will be still in that place. Next, coroners. Coroners is the most like is a simple way of remembering. There is fulvrectomy. Okay, so totally 4: Madliner, Irving, Uchida, and coroners. Madliner means it's a mad, so they will tie and crush it. And Irving's means it will come hugging. It will come to back to uterus, one part of the tube. And Uchida means one part will be open to the top and the other one still remains there, and coroners means a fembrectomy. Okay. Then for cyst presentation in reproductive age, ovarian cyst. Okay, how will they proceed? For cyst, if the ovarian cyst is 3 to 5, all in reproductive age, 3 to 5 centimeter, 5 to 7 centimeter, more than 7 centimeter. If it is 3 to 5 centimeter, then they will wait and watch. If it is 5 to 7, then serial USG follow up. Then more than 7 centimeters, they will do surgery. Okay. Okay. Next. So more than 7 centimeter only surgery. Remember that. Main thing, quadruple test. So quadruple test contains C. First B, next A. Okay. Beta HCG, inhibin A, alpha fetoprotein, unconjugated estriol, that is E3. So you keep it like this. First two, next two. First two comes here beta, the next two the first one alpha. So beta HCG, inhibin A, alpha fetoprotein, and unconjugated estriol. So in Down syndrome, the first two will be elevated. Beta HCG and inhibin A will be elevated. Remaining two remains low. In Edwards syndrome, all will be low. Okay, so in beta HCG will be elevated and inhibin A will be elevated in Down syndrome. Next, Edward Patau. Edward is 18. Edward A, EE 18, and Patau is 13. So Edward syndrome, EDWARD. So Edward E, elongated occiput. D, digits, overlap digits. W, that is considered as V, VST. A, airway defect, and or rocket bottom foot, and D is disability, intellectual disability. Next, 13, that is Patau, PAT. P, palate abnormality. A, additional finger. In Edward, airway defect. Here additional finger. D is 13. A is aplasia cutis, that is in the head will be. Okay, aplasia cutis. And U is VSD. And here holoprosencephaly will be there. Holoprosencephaly. Next, superfecundation, superfetation. So see, superfecundation, fetation, which is more harder, fecundation. So the same menstrual cycle. We know that there is two babies, right? But that is two coitus, like two babies. So remember, if it is in the same menstrual cycle, it is more difficult. So superfecundation. But it's in different menstrual cycle, it is superfetation. Next, the dose of main three: methergine, carboplast, carbetocin. So remember this. Carbetocin means oxytocin, right? It will be given for induction. So carbetocin. Next, carboprast. It's for PPH. Methergine. It's also for PPH. But they will prefer methergine over carboprast. Carbos last because it's contraindicated in bronchial asthma. So you will keep it like this. First carbetocin, next methergine, next carboprast. So carbetocin is 100 microgram. 100 microgram, okay, over 1 minute. And methergine is 200 microgram. It can be given up to 1 mg, that is 5 doses. Carboprast is 250 microgram. It can be given up to 2 mg, so 8 doses. Okay. Next, main, let's ectopic pregnancy, right? So always remember, keep it like this: 3.5 centimeter, that is gestational sac. We have to remember like three criteria, right? First is more or not okay. Second is a medical treatment. Third is the surgical treatment. So we have to remember two values: 3.5 centimeter for gestational sac, and for HCG we have to remember 5000. Okay. So if it is less than 3.5 centimeter and less than 1000 HCG, no need. Less than 3.5 centimeter and less than 1500, which is medical management. Okay, 1500. More than 3.5 and more than 5000, it is surgery. Okay. So totally we have to remember three values: 3.5 centimeter, 1500 and 5000. 3.5 centimeter, 1500 and 5000. Always surgery if it is both or more. But in medical, if it is less, also less than 3.5 centimeter, less than 1500, we need medical treatment. That is methotrexate, right? So next, for androgen sensitivity, insensitivity, and 5-alpha reductase deficiency. So both are more or less similar, right? But okay, we can be taken, this is like part sections. Okay. So here see androgen insensitivity and 5-alpha reductase deficiency. In androgen insensitivity, there will be testosterone, there will be dihydroxytestosterone, but it is not sensitive to the body, right? Receptors are non-sensitive. But in 5-alpha reductase deficiency, 5-alpha reductase, what it will be done? It converts the testosterone to dihydroxytestosterone. So in case of deficient this hormone, there will be no dihydroxytestosterone. Okay. So in androgen sensitivity, as it is present of dihydrotestosterone, there will be like breast changes, Tanner 4 or 5, and female extensile genitalia. In 5-alpha reductase deficiency, there will be female extensile genitalia, but there will be no breast. Okay. But you remember mainly one point, like virilization, clitoromegaly mainly occurs in puberty, means it is 5-alpha reductase deficiency. That one is enough. Okay. Next, the sulfuric acid concentration is needed for staining. For TB, 20 to 25%, leprosy, that is Lepromatous bacilli, is 5%, and Nocardia and Legionella, it is 1%, and spores and head of the sperm, it is 0.5%, 0.25 to 0.5. Okay, so four things: TB, leprosy, and Nocardia or Legionella, and spores or head of sperm. Four things: TB, leprosy, Legionella or Nocardia, spores or head of sperm. First is, remember this, 25. Next 5. Next 1. Next 0.5. Okay. Next, gram staining and AFP staining. For gram staining, we need what? First is carbonyl fuchsin. Last is methylene blue. Okay, carbonyl fuchsin is red. Last is methylene blue, which is blue. For AFP staining, first we use violet. So crystal violet, then iodine, then acetone, then saffron red. Saffron red. This red is coming at last. Like gram staining, first red, last blue. But for AFP staining, first violet, last red. Okay. Okay. This much is enough.